The number that catches families off guard the most, it's not medical bills, it's not tuition, it's not the cost of a wedding. Believe it or not, it's senior care. So think about this. The median cost of memory care in this country in 2026 is anywhere between seven and $8,000 a month. That's per month, right? That's anywhere between 80 and $100,000 a year. And that's for one parent. And here's the part that breaks people. Standard health insurance, it does not cover any of this. Standard life insurance, it does not cover any of this. Medicare, it barely covers it. Now, Medicaid covers it, but you typically have to spend down most of your assets first. So today, I'm going to walk you through exactly what every level of care in 2026 costs. So we're talking about home care, adult day services, assisted living, memory care, skilled nursing, et cetera, et cetera. I'm going to tell you what Medicare actually covers, what most families pay out of pocket, and the 5 ways families end up paying for this. So my goal for this video is that you're able to take this video and have a real conversation because now you have real numbers, not just assumptions. Okay. So welcome back to the channel. If this is your first time here, my name is Winston One. I'm currently studying for my certified and long-term care designation, my Georgia life insurance license, and I'm in the process of acquiring an assisted living community right now. So I'm deep in this world every single day, the operational side, the financial side, and of course the human side. And if you're caring for your aging parents or you're planning ahead for your own care, I want you to hit that subscribe button because we're building something special here, truly. We're building a community of people who refuse to be blindsided by the care system. Now, quick thing before we get into it. I'm not your financial advisor, your insurance agent, your attorney, or your doctor. This is educational content that uses the 2026 national data from sources like Place for Moms, Senior Living, Genworth, et cetera, et cetera. For your specific situation, I want you to look for a licensed professional in your state who can actually look at your numbers. Cool? Let's get into it. Now, let's start with the lowest level of care. This is home care, right? Home care is when a paid caregiver comes to your parents' house to help with what's called ADLs, activities of daily living. So this can be things like bathing, dressing, meal management, medication reminders, light housekeeping. It could even be like companionship. So in 2026, the national average for home health is around $30 to $35 an hour. It could be higher in some of the more metro, like major metro areas. It could be at like 40 to 45 in some more of the lower cost rural areas. It can be closer to 25 to 30. Now, here's where families get blindsided all the time. Most families think that they need about 4 hours a day, 5 days a week, and that math usually works out to like $2,500 to $3,000 a month. For most people, that's manageable. Obviously, it still touches your pockets a little bit, but it's manageable. Now, what they discovered is that 4 hours a day typically is not enough once your parents' needs start to progress. And trust me, your parents' needs can progress out of nowhere really, really fast. And if your parents' needs progress to the point where they need somebody overnight now or 24/7, now you're looking at $30 an hour times 24 hours a day times 30 days a month. If you do the math on that, that's about $22,000 a month. This is why home care, it's a really good starting point, but it does not scale once those needs increase. Now, typically the next thing in that progression is adult day services. And I think that this is one of the most underused care options in America today. It's essentially like a daycare for your parents. So they go to a facility, they get meals, they get socialized, they get activities, they get basic supervision, and then they come home to you for evenings and weekends. And now the national average for this is between $80 and $100 a day. So if your parent goes 5 days a week, you're looking at like $1,600 to $2,000 a month. Now, compare that to home care or to assisted living, adult day is significantly cheaper. Now, the catch is it only works if your parent comes home to a safe environment with someone who can help in the evenings and overnight. So for a working child, whose parent lives with them, this can be a game changer if you can do that. If not, then you got to look at other options like assisted living. So according to some sources like A Place for Mom, the national median for assisted living in 2026 is right around $5,500 a month. Now, this includes a room, right? 3 meals a day, help with daily activities, medication management. They get activities, programming, basic transportation. And the state by state, variation on this is massive. I won't lie. States like Mississippi, Missouri, Alabama, it could probably run you around $4,000 a month. But now, if you're talking like the Californias, the New Jerseys, New Yorks, Massachusetts, even now we're looking at $7,000 to $9,000 a month. So here in Georgia, where we're building our community, it's typically around $4,500 to $5,500 a month. That just depends on the specific metro area, right? This is just median pricing. Now, if your parent wants a larger apartment, they need a higher level of care, they need specialty services, you should expect to pay more on top of that. As a matter of fact, I toured a facility and the base level was right around 4,700. But by the time that they added all the levels of care on top of that, it came up to right around 9,200. So I want you guys to keep that in mind. This was for high acuity assisted living. However, $9,200 a month is still quite a lot. Now, the next progression after assisted living is memory care. And I think this is where the real shock starts to hit, because according to, once again, A Place for Mom, the national median for memory care is right around $6,700 a month. Let that sink in. Seniorliving.com, it actually has the median closer to $8,000 a month. Like I said, that's between $80,000 and $96,000 a year. That premium over assisted living, what that goes to and what that covers is the secure environment, because a lot of these residents, they typically have some sort of cognitive decline. So they need higher staffing ratios. They need dementia-specific programming. And then they need the specialized staff that's been trained on this as well. So it's not like arbitrary. I think it truly is a different model of care. It's actually one of the models that we are incorporating as well into our facility. But for families that are budgeting based on assisted living numbers, when they find out the bill or the sticker on this, it hits hard. So I want you guys prepared for it. The last one is typically skilled nursing. This is the most expensive level of care, where an average room, a private room in a nursing facility, is right around $10,000 to $11,000 a month. Now, for a semi-private room, you're still looking at anywhere from $8,500 to $9,500 a month. And this is full medical care though, right? So we're talking registered nurses, we're talking rehab services, complex med management. Most people don't need this level of long-term care, at least for a long time. It's typically used for like short-term rehabs after a hospital stay. Or if you are progressing past the memory care stage into late stage care. And at that point, we might be looking at like hospice integration, coordinating that with memory care, or you go into a skilled nursing facility. And now, if you're here, you're doing the math on all this, you're starting to feel overwhelmed, you're identifying with some of these situations, I want you to know that that's the right reaction. I think these numbers are very, very sobering. And that's exactly why we built the free senior care cost calculator, like specifically for this moment. So you're going to put in a few details about your parent's situation and your state. It's going to give you a real estimate, not just the national averages that I just walked you through. It's going to give you your numbers. And I want you to comment cost below. I'll send it directly to you, or you can grab the link in the description. Remember, a real number is the foundation of a real plan. Okay. Now, let's talk about what Medicare actually covers, because I think most families assume that Medicare covers all of this. Newsflash, it does not. So Medicare, it covers acute medical care. So think hospital stays, doctor visits, surgeries, some prescription drugs. It does cover up to 100 days of a skilled nursing care after a qualifying 3-day hospital stay. Remember, it has to be inpatient, not observation. And now, of that 100 days, here's the tricky part though. Days 1 to 20 are covered at 100%, and days 21 to 100, you have to pay a copay. Now that daily copay is right around $220 a day. So think about that. For 80 days, you can be charged $200 plus a day. And after day 100, Medicare is going to pay nothing. Now, for all the other levels that I just walked you through, right? Home care for help with the daily activities, adult day services, assisted living, memory care. Medicare does not cover any of this, not a dollar. And this is the part that most families discover a little bit too late. So How do families actually pay for some of this? Well, there are 5 paths. I'm gonna walk you through them. The first path is typically out of pocket. So think pensions, social security, savings, investments, home equity. Most families pay out of their pockets first, and then once those, once they start to dry up a little bit, then they kind of go into the Medicaid option. The second way that they pay is through long-term care insurance. Now, this is not, once again, not financial advice, but I am a huge proponent of long-term care insurance. Now, if your parent was wise enough to buy a policy when they were a bit younger, maybe in their late 50s, early 60s, maybe like up to their mid 60s, this is perfect because now this can be used for these exact same situations. Now, I won't lie, most haven't, and I think that that's a huge blunder. I would definitely recommend doing that. But if you haven't, then the third option is typically hybrid life insurance with what's called a long-term care rider. It's the same idea, right? It's life insurance that gives you the ability to use some of that death benefit while you're still alive to pay for your long-term care. If you don't need long-term care, then your beneficiaries, they get the full death benefit payout. If you do need it, then it draws from some of that. So same idea, just different mechanics. I highly recommend this as well. And then we have Medicaid. Like I mentioned, this is the largest payer of long-term care in America. I wonder why, mostly because people don't plan. Now, what it does require is spending down most of your assets to qualify. The rules vary by state. I think Medicaid is a great option if you qualify for it. But I think to qualify for it, you would have had to either not plan at all, or be hit with a series of unfortunate events, which I would hate that for you. So I would love for the plan to be in place ahead of time. And the fifth option is VA aid and attendance. This is for wartime veterans and surviving spouses. I think this is significantly underused. I think it's worth applying for if your parent qualifies. Most families, they do end up using a combination of these things over time. So like I said, most of them will pay out of pocket while their assets last. Then they spend down to Medicaid, and then they use some VA to supplement if they're eligible. I've seen families use the long-term care policies to pay for it, and then combine some of that with their Social Security or their pensions to be able to get into a very nice facility and take care of them for a while. I've seen a bunch of different combinations of this, right? The key is knowing which path applies to you before the crisis forces a decision. Things always get significantly more expensive and cumbersome and weighty once the crisis hits. Now, the last thing, and most families don't really think about this, is where you live can honestly have such a huge effect. So think about it this way. Senior care costs in Mississippi are dramatically lower than California or Massachusetts. I'm not asking you guys to move to Mississippi or anything like that, right? But if your parent is flexible about the location, then maybe moving to a state that has a lower cost, that can save you tens of thousands of dollars a year. It's not always practical, but it is worth knowing, and I would recommend looking into it. Okay, so let's land this here. The real numbers vary across a spectrum for senior care. Home care, we're looking at $30 to $35 an hour. I think it's affordable, but for limited hours. It's expensive if you're looking at 24/7. Adult day services, you're looking at anywhere from $80 to $100 a day. I think it's underused. It's great for daytime care, but you got to be prepared for nights and weekends. Assisted living, the national median is around $5,500 a month. Memory care, you're looking at $8,000 a month. Skilled nursing, you're looking at close to $11,000 a month for a private room. Medicare is going to cover almost none of this except for the short-term skilled nursing after the qualifying hospital stay. Most families, they'll use long-term care insurance, or they'll pay out of pocket, or they'll use Medicaid once they spend down. And now here's what I want you to do next. I don't want you to be surprised by this. I don't want you to be overwhelmed by this. I want you to use our free senior care cost calculator and put in your parents' situation and your state. You're going to get real numbers, not just these national averages. Or you can comment cost below. I'll send it directly to you, or you can hit the link in the description. It takes 2 minutes and it gives you a real number with a real rationale, like an explanation as to why this might be your cost. Okay? Remember, a real number is the only foundation of a real plan. Once again, I'm Winston One Day. I want y'all to plan early, plan smart, and most importantly, take care of each other. I'll see you in the next one. Peace.